Hi, welcome to Apraxia Kids Childhood Apraxia of Speech 101. We decided it might be a great idea to have an introduction to childhood apraxia speech webinar. So Kathy and I are here to join you. So thanks for joining us in talking a little bit about this challenging speech disorder. I'm Dave Hammer. I'm the Vice President of Programs here at Apraxia Kids. I first worked at Children's Hospital Pittsburgh for 35 years and then took the position here at Apraxia Kids 4 years ago.
And I'm Kathy Hennessy. I'm the Director of Education here at Apraxia Kids, and I'm here because I have two children with apraxia of speech. One is 28 now and one is 26. So that's where I'm coming from.
I think the first thing that would be helpful for us to think about it, what would it be like not to be able to talk? And we have two videos that would like to show 2-year-olds, because I think that's where we can first get some indications of early speech and what we can expect, but also looking at these videos, certainly we can see the struggles that both of these children are going through. So we're going to take a look at a video first of Sean. He's actually at home with his brother, his mom, and his early intervention therapist.
Okay.
And then we'll take a look at 2-year-old Lila, who's with her outpatient speech language therapist.
So we're at home and in the clinic.
That's right.
Great.
Exactly.
All right.
Can you go up? Say.
Let me try.
Oh, Sean, do. Up. Sean, up. Say up. Up. Good try. Good try. Up. Up. Good job. Ball. Ball. What? Ball. Sean, tell me ball. Sean, ball. Good job. Ball. Good job. Yay. Big boy, ball. Ball. Look what else. Old MacDonald had a farm, E-I-E-I-O. And on this farm he had a cow, E-I-E-I-O. Ready, Sean? Say, pop, pop, pop,
Pop. Let me try one.
pop.
I will try one.
Down. Farm he had a pig. E. Keep turning. Keep turning. E-I-E-I-O. Ready? You say pop. Sean. Pop.
Okay, what one would you like next? The tractor or the hen? You pick. Tractor or hen? Which one? I think you want the tractor. Good. Let's try it. 2 tippies. This is tough. Oh, let's whisper. Let's whisper. Thank you for whispering. Do you need more? All right, well, let's use that M. Ah. Oh, okay. Thank you very much. I'll put those over here for now. Let's try that M one more time. Ah. Very good. I like it. Now you wanted the horse. Yeah, so let's try it. Horse. Horse. Try that with an H. Good try. Ha. Good. Let's try it again. Ha. Nice try. Ha. Good. I like how you started with your open mouth with your H sound.
So when you look at these videos, it's obvious that these two are struggling, and we take it for granted.
We do, and the reality is it's a wonder that any of us, it's amazing that any of us can speak at all.
Absolutely. When you really consider what it takes to what we call motor plan, the Speech Act, Let's take, for instance, the word snooze. Hopefully, something nobody will do as they're watching our webinar.
Or us.
Or us. The word snooze, let's take that for an example. First of all, it starts with an S, right?
Mm-hmm.
Our brain has to tell our teeth to come together, build up pressure behind the teeth of air, and then release it slowly to make that sound. Right? So it's continuous airstream. At the same time, it has to tell our vocal cords down here, don't vibrate together, keep open so that just air comes up through. Then you have to go to N after that, right? N is a sound we call a nasal sound. It has to go through the nose. So your palate has to open in the back, that little flap of tissue that you see when somebody's laughing on a cartoon. That uvula has to come down, allowing air to come up into the nose to make the nasal sound.
All in a matter of less than a second.
Oh yeah, oh my
I mean,
gosh.
So
milli,
that's,
milli
exactly,
seconds.
exactly.
And then, so you go from st, and then ooh, your lips have to come out for ooh, and your voice box has to come on. And then zzz is the same as s, but your brain has to tell the zzz sound, yes, your teeth are together, you're letting out air, but vibrate your vocal cords this time.
This time.
Exactly
Yeah.
the same sound.
Right.
And then, of course, E at the end of snooze, we have to forget about has any sound to it
Right.
whatsoever in English, that we're just going to say snooze.
And most kids do this without even thinking about
Absolutely.
it. Right?
It
So-
might not be one of the first words they say. It's a little bit complex,
Well,
but
once that would be a little.
yeah. But
We'd be talking
yeah.
about something different if that was what was going on.
We certainly take for granted though, and when we
Right.
break it down into all its component parts, it really is amazing that any child or any of us speak with any degree
Right.
of
Exactly.
clarity. Yeah.
Exactly. So just to turn the conversation a little bit to childhood apraxia of speech, one of the first questions we always get is, well, how many kids have apraxia? And so we talk about incidence and prevalence, and you can see on the screen some of the statistics that we're dealing with here. But when we talk about incidence, we're talking about the number of new cases that come up in any given time, and prevalence would deal with the number of people who were living with that disorder at any given time. So Dr. Larry Schreiberg, who is one of our leading researchers in the field of childhood apraxia of speech, says that due to a lack of diagnostic markers and really specific diagnostic instruments to really target the diagnosis of childhood apraxia of speech, it just really frustrates those efforts to provide really definitive estimates of prevalence and incidence. So the fact is, the bottom line is, we have an idea, but we don't really know for sure. So the next question that we get all the time is, what causes childhood apraxia of speech? And I think parents who have, children who struggle, and I know when my kids were little, I wanted to know if it was something I did. And, your neighbor's gonna tell you, well, you put Johnny in front of the TV too much and that's why he doesn't talk. Or, grandma's gonna say, well, none of my kids were in daycare, so, they all talk fine.
Or everybody talks for them. They don't have to talk.
Exactly.
Right?
Or
So,
we could talk about Einstein here.
oh yeah, right, exactly.
So no matter how old your child is, whether your child is 2 or 3 or 4, Einstein didn't speak till a year after, whatever that age is.
To make you feel better.
To make you feel better.
Make you
So if
feel
my
better,
child is
right.
3, people would say, well, Einstein didn't talk till he was 4, so don't worry about it, it's all gonna be fine.
Or Joe up the street, he didn't talk till he was 5. Look, he's an attorney.
He's
it's
a
always
neuroscientist
a
now,
neuroscientist,
yeah.
attorney, whatever.
Exactly.
Successful people,
Exactly.
but they didn't talk, so don't worry.
So you're gonna hear a lot of different things from a lot of different people, but our reality here is that there are absolutely no studies that indicate any kind of direct relationship between complications in pregnancy and childhood apraxia of speech. So the bottom line is, there's nothing that you did that caused this.
Right, I mean, we can look at other kinds of speech and language disorders and say, well, maybe a parent didn't stimulate their child enough or whatever, but childhood apraxia of speech is has to do with the motor planning aspect of speech. And if we look at that, then it doesn't matter, you know, the parent could read to their child all the time, stimulate their child all the time, and that's what many of our parents are doing. You know, they're
Exactly.
talking to their children, reading to their children, and we just expect it to happen. So something else is going on that we need to pay attention to.
Well, and it's that whole motor planning.
Right,
So again, I don't think we can say it too often. There's absolutely nothing you did that caused this. So.
And parents do, and I've talked to many parents who hold that guilt. You know,
Oh,
was
absolutely.
it something I did in my
Right.
pregnancy?
And then the guilt will move on to, am I doing enough? But
Yeah.
right this
For
minute,
now,
this is what we're talking
exactly.
about.
There's enough guilt to go around for sure, but
So, yeah.
So we have a national organization, the American Speech and Hearing Association, who back in 2003, seems like so long ago now, asked a number of us to serve on their ad hoc committee to come up with a definition of apraxia, talk about the state of the art of the research at that point in time, and also to talk about some of the key factors and ways to treat apraxia of speech. So I was fortunate enough to be part of that ad hoc committee, and it took 4 years to put together that document. And it's now almost 11 years old, but it still is a working document. I think parents can find it helpful
Absolutely.
as a reference.
Mhm.
And they can find it on our Apraxia Kids website or at asha.org, ASHA.org. So you can see the next slide gives the definition of childhood apraxia speech that we came up with. And if we, as a speech pathologist, would, you know, if a parent asked us what is apraxia and we read this definition, they'd say, let me ask again, what is apraxia? Because you can see we have some terminology in there where it's called a neurological speech sound disorder, and the precision, consistency of movements are impaired. The important part about this definition, Kathy, is that it also talks about it's not a weakness issue. It says in the absence of neuromuscular deficits, which means this isn't about muscle weakness. This is more about agility and motor planning. And
Well, and that's important in terms of, for parents to know in terms of treatment.
Right.
What you're looking for in your child's treatment. So we're not trying to strengthen anything.
yeah, that's right. And so we, as an organization, Apraxia Kids, came up with a chart, a diagram, picture, associated way of looking at, you know, an idea, here's what I want to say, and what he wants to say is, I want to say something. And it walks you through all the kind of planning, programming the brain has to go through before the person on this chart is able to successfully say, I want to say something. And in green there, it shows you at what point in time children with apraxia then have that difficulty in that motor plan.
Well, and this is a great graphic too, to show to grandma or somebody who doesn't understand, you know, what you're dealing with here and what your child is dealing with. So this is, I think, a really uncomplicated way to explain it,
Right.
and to help other people understand.
I think it's also important that it's not connected to intelligence whatsoever. So in those early
Absolutely.
stages, when the child has an idea, they can go through what any other child goes through in terms of understanding what they want to say.
Right.
I mean, certainly some of our children with apraxia speech have lower levels of intelligence than others, but that's not causing the apraxia.
Right, and we're going to talk about some of those
we
co-occurring
will,
issues in
yeah.
a little bit, but absolutely.
Yeah.
And I think that's something that as parents we really need to be proactive about, is explaining to people that this is not a cognitive issue per se,
Right.
and that, you know, our kids, even though they can't express themselves, they're going to understand everything that's being said around them, and I think that's really important to remember as parents.
Yeah, but a percentage of our kids with apraxia have no difficulty
Right.
in comprehending language or in their cognitive skills. Now, you know, we know that there are challenges for some of our children, and we'll, again, address those in a little while. I think it might be a good time to just give an example of a motor planning challenge, so I'm gonna use you as
I'm guessing
my-
I'm going to be
Yeah,
challenged, right?
absolutely,
Okay.
absolutely. So this is something I actually do when I have parents come for an evaluation to demonstrate for them what it's like to have a novel motor plan. And then it leads us to talking about the considerations we give when we're looking at therapy strategies. So here's what we're going to do. We're going to face each other here for a second, and we'll just put our hands out like this, and then flip your hands in and grab your hands together like this, and then pull them up like this,
Okay.
right? And now we're going to ask each other, pick up your right index finger, pick up your left pinky finger, and just try a couple of fingers, right?
Okay.
So pick up your right index finger, pick up your left ring finger,
I don't think I could do this.
pick up your
I can't do it.
left
Oh, there it
pinky
is.
finger, right? So you go through that and
Yeah. Like
realize
really just sit and think. Like,
you have to really concentrate because you
Mhm.
can't really easily figure that out. You have to
Right.
think a lot. And then the second way I demonstrate this is I release my hands and you keep your hands intertwined,
sorry.
okay? And then I like touch a finger, pick up this one, pick up this one, and to see whether or not that helps, right? That's a cue to you,
Oh my God.
and it
Oh,
might help.
good.
And then the third stage of this is I have you close your eyes, and then I say pick up your right index finger, your left pinky finger.
Okay, that's almost easier.
Okay.
With your eyes
So-
closed, right?
So what we can learn from a demonstration like that is,
Okay.
first of all,
Kathy,
this-
there's no coordination.
yeah, well, we might learn that. First of all, this is a complex, novel motor plan that nobody's ever likely demonstrated to us before.
Right.
And that's the way it is with our children with apraxia. Very few children with apraxia have it because they've had an accident or injury. There are other kinds of speech disorders that often result from that. It may be a feature of children that have had a brain trauma or accident, but it's less likely than dysarthria, which is the weakness issue that occurs. So it shows us that this is a new motor plan for our children. They've never
It's
had
like a
it.
tiny window into what they do,
Yeah.
deal with 24/7. Right?
Yeah. I try to come up with this motor plan. Oh no, I've never done this
Right.
before. This is awkward.
Right.
Oh, and so some people even have difficulty just doing this
Right.
three-stage motor plan. And it's like putting three sounds together to make a word,
Right.
putting three syllables together to make a longer word, or putting three words together in a
Right.
sentence.
Right.
Or phrase.
Yeah, I mean, you can easily see why a child might get frustrated quickly and give up.
Yeah,
Right?
for
So,
sure.
yeah.
And the second thing it can show us is, what not all therapy strategies work the same for all children. So you closed your eyes and said, that really helped me. Another person may close their eyes and say, that didn't do any good.
Right.
Touching your finger helped you, might not help the next person. So we really have to figure out which strategies later on work for all our children.
Well, and I guess I would imagine too that if you keep using the same strategy, it would stop working as well, and that you might have to find a new way.
Yeah, that can happen, for sure. So we're building those motor plans through what we do.
Yep.
Yeah, thanks for being willing to do that demonstration.
Yeah, I'm always willing to put myself out there, Dave.
So the other question it's important to ask is who should make this diagnosis,
Right.
right? And I see on Facebook and social media all the time, my child was diagnosed by and fill in the blank.
Right.
Pediatrician, developmental pediatrician,
Plumber.
I've heard psychologist,
Uh-huh.
and pediatric neurologist. So we really have to take a look, and we'll look a little bit later about, how much do physicians really get trained
Right.
in speech and language, let alone in a disorder like apraxia.
Well, I know that when, I'm trying to think which kid it was, but Andy, I guess, was little, and he was in therapy for a year and a half maybe, with early intervention, and finally I got a little bit frustrated and took him to a private therapist who diagnosed him with apraxia.
Mhm.
So I came back to the early interventionist and I said, oh my gosh, he's been diagnosed with apraxia, like I never heard of that. She goes, oh, that's what I thought it was. Oh my gosh, a whole year and a half that I never heard that word, and it was in her head, and my levels of frustration at that point were skyrocketing because I felt like we could have had more targeted therapy during that year and a half with a definitive diagnosis, and maybe she couldn't have really made it at that time, but to give me that word so that I could start understanding it and learning it. But yeah, so that was frustrating.
No, it definitely is a speech language pathologist diagnosis to make.
Yeah.
And I hear quite a bit that a school-based therapist is not allowed to make a diagnosis or can't make the diagnosis. And really, if you're a certified speech pathologist and have a master's degree in speech pathology, you should be able to make this diagnosis. Now, some feel more comfortable than others, so you may, as a speech pathologist, decide, I'm not so comfortable, I'm going to send this child to a specialist, a therapist who specializes in childhood apraxia, and that's fine. It's just that they should be able to make the diagnosis. It's not a medical diagnosis per se.
Right.
There's no genetic testing or brain imaging testing that tells us definitively this child has apraxia of speech. We're not there yet. We hope to get there at some point in time. But right now, we have to go by our clinical findings, what we see and hear from the child.
Characteristics.
Yeah, for sure. Yeah, so we have to ask the question then, how young is too young? Which is another question we often hear. And you'll read in the literature or just in social media, you can't diagnose a child until they're X age.
Right.
And, there's no real strict guidelines. Those of us who have children or work with children know about those precocious 2-year-olds that are willing to put themselves out there, give us a sample of speech that allows us to see, whoa, they're really struggling with getting their sounds, made or together in sequence. So, I've seen very young 2-year-olds. Lila, who we just took a look at, is a little girl who really showed us a lot of early symptoms, and sure enough, later on,
So really,
continued that.
it's about how much conversational speech they are willing to have with a speech pathologist. Right?
Yeah, how much vocal output they're willing to give and try to imitate and do things on demand. It gives us a good sense as to how much struggle they're having. Now, that age group is really challenging, right? Because I call it they're in the Declaration of Independence stage, as opposed to terrible twos, because we want them to go through it, and usually they go through it when they're in the early 3s. So parents, don't think you're out of it if the child just went through the 2s and you went, shoo, I got out of that one, because it's usually early 3s. So, and also, if they haven't been very successful at speech, they oftentimes, many of them stop taking the risk to give you a sample.
Exactly.
Or they give you a small amount of what they feel they're good at. Like they may say mama for you.
So at that point, if the therapist is thinking, well, maybe, but I don't know, is there something they can?
Yeah, we have a term that's supported by our national document that we wrote called suspected childhood apraxia of speech. And I think what I generally do is say, let's give it 6 months of treatment, and then we'll revisit this. Because I'm seeing some early indicators that your child has some struggles with their speech motor planning system. And sometimes after 6 months, the child blossoms, but we don't know yet which
so
children
in that
they may
6 months,
be.
your child has the opportunity to get comfortable with the therapist and is going to be more willing to take those risks.
That's right.
And
you get a better sample over time. You get to experiment with, where their breakdowns occur and get a better feel. So,
So the other question that we get sometimes is, what is, I've heard this term pure apraxia, and what is that? Is there such a thing? And I've actually run into people who say there is no such thing as pure apraxia, meaning that's the only diagnosis that the child will have. I'll tell you, my personal story about that in a minute, but I just wanted to share that there was a study done at Mayo Clinic by Ruth Steckel, in 2016. It was a retrospective study where they looked at almost 400 children who had gone through Mayo Clinic between 2007 and 2015, and who were also given the diagnosis of apraxia by one of the Mayo SLPs. And what they found, they were looking for co-occurring issues. What else was happening with these kids that had gone through Mayo? And they came up with a list of things that were fairly common, I guess, that they were seeing in these children. And the list is really varied. They were looking at developmental delays, cognitive delays, some dysarthria. There were some genetic anomalies going on, feeding issues, GI issues, hearing problems, neurologic problems, behavioral disorders, visual problems, and my personal favorite, expressive language delays. So they were seeing other issues going on. Yeah.
Which complicates it for our children. You can't just get their motor planning system going and say, oh, he's going to be just fine. And there are some, genetic conditions that are associated with, higher likelihood of apraxia of speech. So it's not like we don't have some of those that we can say, oh, this child has a specific genetic syndrome, they're more likely to have apraxia of speech. It's just we don't have a gene that we can point to and say, yeah, there's an abnormality.
The other question we get a lot is the autism and apraxia.
Oh yeah.
Because my child has autism, he has apraxia, when in fact that's not necessarily true. Now, children with autism can have apraxia, but if they have autism, that doesn't mean they do have apraxia. So we're looking, there's studies out there looking at linkages, but as of right this moment, they're not necessarily connected.
Right.
In
And
any
I've
way.
seen it both ways, Kathy. I've seen children come with the diagnosis of autism when really they have, pretty severe apraxia and some mild sensory issues going on. And two chief characteristics of autism, but really they don't look like a child with autism in many other ways.
Right.
Or the children that come with the diagnosis of apraxia and they truly have more autism characteristics as well. So, and there's children with both.
Right.
And that makes it really challenging
Right.
when they have more than one issue to deal with.
Right.
There's bigger challenges. Their prognosis is more guarded, and their progress is generally slower.
Right.
And it's just reality.
So in our house, I actually had one of each. So my older child, who is a daughter, really does have pure apraxia and has no other issues than the verbal apraxia. And she was in therapy for 7 years, but she made tremendous progress once we figured out what was going on and started targeting the therapy. My son, who is younger, has 6 diagnoses, and we didn't get the last one until he was, I think, a sophomore in high school. So it took a very long time to sort of, and we always talk about it like an onion, right? You peel back the layers and see what's there as time goes on. So as it turns out, he is probably the more typical child with apraxia.
Yeah.
So his progress was a little bit slower. I am happy to say that they both are intelligible speakers, more than intelligible, I guess, and function quite nicely in the world. But if you put them side by side, even today, if you put them side by side, you would never know that they had the same diagnosis, same basic diagnosis. So if you've seen, as you always say, if you've seen one child with apraxia, you've seen one child with apraxia. So
and I like your image of pulling back the layers, because it is a journey for parents and the children. They may get over one hump and then there's another hump, and I think that sometimes most parents watching this are probably in the early stages, but we just want you to be prepared that it is a journey, and we as an organization are here to support you on this journey. And if they have other issues, the apraxia issues, if they are more resolved over time, won't take care of everything. I think that's an important thing. If a child has some cognitive impairments, then it's not going to make them no longer have,
Right.
some cognitive challenges.
Yeah.
But we know that children with apraxia, if they don't have other co-occurring issues, can really get to the point where, knowing your daughter, you talk to her on the street, you'd never know
You
that
would
she
never
had
know,
any struggles,
yeah.
but you watch those early videos of her and
Right, or if
It's still
she's
apparent.
done a lot of, participated in a lot of research,
Yeah.
where they have tried to break her speech down and have been very successful in doing it, to her surprise. So it is underlying, it doesn't
Mhm.
really, and even my son with the 6 diagnosis, that really did complicate his life for a long time. He certainly is, out in the world doing what he chooses to do. And I think, when they were little, that's all I really wanted, was for them to be able to choose,
sure.
to do whatever they chose to do. So, yeah, I mean, it's a long battle, but it's not an unwinnable battle for all of us.
For sure, and somebody has to start that journey, right? And then,
Right.
so I don't recall exactly who it was for you that got you to go, okay, I better take that, my first child to somebody to get her speech and language checked out. But that's an important person in your life who,
Mhm.
and it may have been you that said, used your instincts. And I always talk to parents, trust your instincts.
Well, it's interesting because, of course, it's your first child.
Yeah.
You're like, those first words, I can't wait. And you're waiting and you're waiting, and you almost don't want to say it. Like, you kind of know, like,
Mhm.
something's going on here, but you don't want to say it.
Sure.
So in my world, it was actually our pediatrician.
Oh, that's great.
We were there, and she wasn't even 2 yet. And
Wow.
he was, I think there might be something going on here. Maybe not. Like, don't get upset.
Mhm.
As he hands me Kleenex. He said, but let's take her down to in Pittsburgh. It's the Child Development Unit at
Mhm.
Children. He said, let's take her down there and see what happens. And so yeah, it was the pediatrician
Wow.
that
That's great to hear.
started us on the journey. Yeah.
Certainly, pediatricians sometimes can get a bad rap about not
Absolutely.
making referrals or saying wait 6 months. And in all fairness to them, they sometimes see a child at age 2 not talking at all, and at 2.5 in their next 6-month visit, they're talking a blue streak. So until we get better handle on how to help them know what the factors and the questions are, I
Right.
think they are using some of their own experiences to say things like that to a
Mhm.
parent.
Right.
Certainly, a relative could be the person that would
Right.
suggest that you go get help.
Mhm.
Sometimes it's a person outside, when you're deeply involved with your child, you just don't see some things, or you don't want to see them as like you do.
Mm.
And I found it interesting, sometimes a grandparent is the one who says, don't worry about it, they'll grow
Right.
out of it.
Right.
Because you don't want, as a grandparent, your
Right.
grandchild to have anything wrong with them, or they're the ones that say, hey,
Right.
I know you're hesitant, but I think you really need
Yeah.
to. And I've seen that happen both ways, where the grandparents are the reason the parents have come to see
Right.
me or somebody else for an evaluation.
And it's hard to hear. I mean,
Oh, yeah.
we get it. It's hard to hear as a parent. You don't want to hear it.
Right.
But at some point you have to buckle up and,
Teachers
could be teachers.
are
yeah.
critical partners for us in the journey, but they
That's true.
see lots of children. And they may be the ones that say, whether it be in the daycare, the preschool setting, or even some of our kids aren't diagnosed till a lot later, they're going, something's a little bit different.
Mhm.
Just had a call from a teacher the other day of an older child who said, this doesn't sound like the other children I get that have,
Really?
an R distortion, S distortion. There's
Mhm.
just something different.
Wow.
And I really commended her for,
Yeah.
saying, I'm trying to get our speech pathologist to take a look at apraxia for this
Mhm.
child. So,
Wow, that's pretty interesting.
Yeah,
The
it is.
teacher
Mhm.
would recognize that. So let's talk about pediatricians a little bit more.
Yeah.
Where we as an organization stand on all that.
yeah, as far as we've come as an organization and having resources available to parents and professionals and related professionals like MDs and pediatricians, we still have a long way to go. We know that there are physicians out there that are saying wait, but we have to take that responsibility to help train them more. If you think about it, there's so much the physicians have to learn in medical school. And speech and language is only one portion of all the information they have to learn and understand. And then you break down speech and language development, they may just get the basics of it. And they can't tear apart every speech and language disorder that children may have.
Right.
So we have a role to play, I think, in helping them to know what questions to ask.
Absolutely, it's our job.
Yeah, it
as an
really
organization.
is. So we're working hard on it. I think if we look at some of the possible early indicators that we can help guide pediatricians to.
Right. Wasn't there a study, Dr. Overby?
Yeah, there's a study going on, two authors, one from Pittsburgh and one from Philadelphia, here in Pennsylvania, where they're taking a look, it's very unique. They're looking at children later diagnosed with apraxia or another speech disorder, phonological disorder, comparing the early videos that parents have of them when they were infants and making sounds,
Oh, cool.
to try to see if there's some early indicators that show these are the children more likely to end up with apraxia versus another less severe speech
That
sound
is
disorder.
interesting.
And they're already finding some, some great differences that will enable us to tell pediatricians, here's the questions to ask. Right,
That's
like
the key.
the
right.
variety of consonant sounds in their babble.
Right.
So you may have a child that's noisy but just going or a child that babbles and just going ba 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 and no other sounds. Well, that could potentially be an early indicator.
Right. I think what's really interesting about what you just said is that the pediatrician asks the right questions.
Yeah.
Because as parents, we don't have the vocabulary. We don't know what that thing is that we're looking for yet. We do eventually, right? We know what all that is, but when we're first starting out on this journey, we don't know the right questions to ask and to answer. So I think that it's really imperative as an organization that we do educate pediatricians on what the right question is, and that's really commendable for Dr. Overby and Sue Casperi to be working on that.
Yeah. And one pediatrician recently told us he trains the residents to ask the question, how many words does your child have? And it's all based on how many words, not clarity or sounds or whatever. So, just simple things that we can tell them, like how much of your child's speech can be understood by an unfamiliar listener.
Right.
By 75% of a child's speech should be understood by somebody that they don't know. Well, our kids with apraxia aren't even close to that
Not
oftentimes.
happening.
Yeah. So I think we have a ways to go, but we're working hard on getting the word out.
Right.
Yeah.
Excellent.
So, as I was mentioning about some of the early indicators, one of them would be that lack of babbling. We often hear from our parents, oh, he was such a good baby. He was so quiet, he never put anything in his mouth.
Right.
We want our kids, to be putting their hand in their mouth, their foot in their mouth, and later on they'll be putting their foot in their mouth a lot as they become adults, but a toy or object in their mouth and making sounds around that, because it's not only the motor planning that's important, but the sensory input they get from that helps build that awareness of where my tongue is in my mouth, what my lips feel like, and without that, our kids miss out on those early stages. So, and then when they do vocalize, they may have, as I mentioned, limited amount of sounds in those vocalizations. That's an early indicator. If they're just like or ba 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 and no other sounds, and we get children oftentimes that lose words out of their repertoire. They may have them and lose them.
Right. I can remember when Katie, my daughter was little. My mother and I were like, oh, she's going to be such an early talker because she had this word or that word, and she lost them.
Yeah.
Like, what happened here? But I was saying earlier that you put my two kids together and they look totally different. My daughter was babbled, had some words, and then didn't. But my son never even tried. Never babbled, never tried. So it can happen both
It can
ways.
happen both ways,
Yeah.
for sure. And it's not always the children didn't babble that end up with
Right.
apraxia, just as your example is given. But it's one of our early red flags that
Right.
we can at least point to and say,
Right.
child a bit higher risk. And the loss of words, a little caution here, is that as we have to remember what's normal, right? In typical development, children have words that become really important to them. I remember my son saying dat for everything. So my dad made him this little wooden holder for his baseball hats, had dat on the top. As soon as my dad finished that project, that was out of his
That was
repertoire.
gone.
It wasn't an important word. So we have to remember that, but
Yeah.
you know, and always understand what typical development is like and,
Right.
and what kids do. But certainly use those instincts, parents, when
Mhm.
you're
Absolutely.
feeling something's
Yeah.
off track. Other possible indicators that we see, we call it oral groping.
I was going to ask you where groping fit into all
Yeah,
this.
right.
That's the one thing you always hear about. Right?
Yeah,
Yeah.
you do. Not all children will grope that have apraxia speech, but it's like, well, if you've seen somebody who stutters severely, you see them trying to, get rolling,
Right.
get going. And our children sometimes have that. Where do I put my lips? I think it's there. No, it's over here.
Right.
And so they're grappling for that oral posture to get rolling, get started. So that's a red flag to us. When children have vowel distortions, that's not very common. And vowels carry a lot of meaning. It's amazing if you hear somebody talk just on vowels, how much you can understand and pick up from their
Right,
vowel.
right.
So if they have vowel distortions, it really makes the clarity.
Well, and it does. Even those vowel distortions later on have a lot to do with literacy.
Yeah, yeah.
They can make literacy a little bit difficult, and spelling.
Differentiating two words, I remember
Yeah,
one
right.
little boy working on if and F. Like, that's such a subtle difference.
Yeah.
And but it makes a difference in the meaning.
It does
for
make
sure.
a difference.
Our kids have difficulty speaking on demand. Like,
Oh,
we
absolutely.
try to tell our parents, don't, what'd you do in school today? Or
Mhm.
say this for grandma, because boy, that's where they fall apart the most. It's not like we
Yeah.
can't use imitation as a therapy method
Right.
or to support them, but they have difficulty coming up with that motor plan immediately.
Right.
Yeah.
Yeah, and I didn't realize that early on, and I'm like an Apraxia don't here actually. But, and every day my son would get in the car and I'd say, well, what did you do today? Or who did you have lunch with? And he'd be like, nobody, nothing.
Mm-hmm.
So we kind of invented two friends for him. One was called Nobody and one was called Nothing. And so we got in the car one day and I said, oh, guess what happened today? And he's like, what? I'm like, nobody, nothing, they moved, they're gone. They don't live here anymore. But yeah, so you're absolutely right. It's the
Yeah.
kinds of questions that you ask that can help our kids.
I think one feature that's frustrating both for parents and for therapists working with children with apraxia is their inconsistency.
Yeah.
You can't predict how they're going to say the next word. They may be inconsistent. They'll say the same word 3 different ways. Or they may be able to say and mama, but they can't say in any other words. You hold up a sheep and they go ba, they can say what the sheep sounds like, and then you hold up a ball and they go, like, where's that ba that you put in ba?
Just have it, yeah.
They have expressions and vehicle noises, but they can't put those same sounds into words. They have pop-out words, as we mentioned, come out once, not again.
Well, and those are really frustrating for parents too,
Yeah.
because I can remember, the kids being in the family room and I was in the kitchen getting dinner or something, and like this word would come out and I'd go flying into the den going, oh my gosh, say that again. Nothing. There's crickets, right?
Absolutely.
There's nothing.
Yeah.
So, yeah,
So, what can help, I guess, is the question.
right.
Yeah.
That's what we're here for.
We're here for, yeah.
So just it's sort of what we've talked about, right?
Yeah.
Like early recognition,
Mm-hmm.
getting that evaluation. If you feel something's off, listen to yourself. Like you know.
Yeah, you can't really harm a child by getting them an evaluation early and having a therapist say to you, you know what, they're showing a lot of positive signs that don't indicate apraxia. Let's, here's some helpful suggestions. Here's what to watch for. Or if you do pay attention to their speech motor system in early therapy, and you find out later, it doesn't look like apraxia, you haven't done them any harm.
Exactly.
You've really, a lot of what we do is really building language and a sound system.
Right.
Yeah.
Nobody's ever been hurt by speech therapy.
No. Right.
But so what we do know works, if your child does end up with the diagnosis, what we know works is therapy.
Mm-hmm.
Intense, targeted therapy.
Yeah, and I think that's what poses the challenge for parents to be able to get their children to the therapy they need, for school districts, for early intervention agencies, private therapists, hospitals, whatever, to provide enough therapy to make a difference. And a number of our children have to be seen sometimes, some therapy sessions in school and some privately.
Right.
The expense that comes along with that, the time it takes to transport them, we understand that's a
It's
a
tough.
challenging part of the journey.
It really
But
is.
we know it can make a difference. We may not, for those suspected children with apraxia, we may not need as much intensity because they're younger, we're setting the stage, we're teaching the parents some things to stimulate, but once we realize, they've got some motor planning struggles, we want to get in there. And our national document says 3 to 5 times a week of individual therapy.
Right.
And but without parent practice or teachers being on board, that's still what I call spitting in the ocean
Still not enough.
as to how much therapy or time is needed for that practice to get the motor plans established.
And I always said when my kids were younger that it was a lifestyle.
Yeah.
Right? It's just a lifestyle. But so what about other things like fish oils and supplements and
Yeah, you read a lot about that, and
Yeah.
people have lots of questions in social media about, and you'll see some people who swear by the fact that it made the difference in their child when they changed their diet, gave them fish oils. Our response as a national organization is we can never say to a parent, don't do that.
right.
What we can say is to get good medical advice from your child's pediatrician. There's sometimes reasons why children shouldn't go on
Right.
fish oils or whatever, or shouldn't have a diet change. Please know that it can be costly. It can make big adjustments in your life when you have to change diets for everybody, and it's not going to work for all children. It may impact other things like attention and focus that then help a child develop speech because now they're
Because now
attending
they're
better.
paying attention, right?
So,
The one thing I really, caution parents about is looking to social media and Facebook for things like dosage, things like that. The answer is you need to check with your pediatrician, and just because such and such a dosage might work for one child, it might really not be beneficial and even harmful to another child.
Sure.
So please don't take medical advice off Facebook or any social media platform for that matter. It's, you need to see the person who knows your child, and that's your pediatrician.
yeah, if anybody says this is the kind of therapy you should get, or this is who you should see to get your, diagnosis.
So we're not just talking about, fish oils
Right.
or, whatever, some kind of diet. It's everything. It's therapy. Because one therapy works for my child doesn't mean it's going to work
That's right.
for your child. And
Exactly.
6 months later, it could all be different anyway. So, as to what is working, what isn't working. So
I think we as an organization have worked really hard to make available to parents the resources that enable them to do some critical thinking and to use their instincts along with some guided education, both for the diagnosis and therapy part of this whole journey.
Absolutely. And on our website, which is free for everyone, there's a multitude of articles on different therapy approaches, different things you can do, things that you can pull off, letters to give to your teacher, just all different kinds of things that have to
Help
do
those
with
transitions.
Well, right.
Yeah, our
right.
children need to be understood that, that when they move from, the daycare to the preschool or the preschool to kindergarten, that teacher understands
Right.
what apraxia is all
That's a big
about
deal.
and what strengths the child brings with them that can help them in their learning.
Right. So the consistent thing through all of that because your child may have, you know, 2 speech therapists, an occupational therapist, in their lives. The consistent thing with that is what happens at home and how you support that at home.
Right.
And we can't say strongly enough that the support at home, learning what to do with your child at home, and that can be, and for my kids anyway, sitting down at the kitchen table and practicing speech was never an option. At one point, between the 2 of them, we had 13 sessions of some kind of therapy each week. So there really was not a lot of sitting at the kitchen table and practicing speech. But that said, they had to have a bath every night, and they were kind of a captive audience in that tub.
Yeah.
And so we practiced speech in the tub when they were in their car seats. You know, we sang a lot.
Yeah.
You know, and they would sing with me, and just, you know, taking a walk. You know, if you know the targeted sounds that your therapists are working on and what they're trying to achieve in therapy at that time, then you can make what happens at home really supportive of what's happening in the clinic, and that's what's going to help your child
Sure.
the most, I think.
Car riding time, all those times where you're more one-on-one and have a chance to.
Well, and Edie Strand always talks about when you're in the grocery store, right, and your child is sitting in the cart facing you, they're like eye level, they have to look at your face, and you've got a whole store in front of you, you know, to pick your target sounds from. So the grocery store was always a big therapy place for us. I don't know what people around us thought, but
And I think, you know, we can look at the things that can help, but also some things that, what can go wrong, you know, in this journey. And this next video that we have sets the stage for that. It's a parent's perspective on when she first started therapy with her son and what wasn't working, and then what eventually worked for him. So let's watch that, and then we'll comment about what else can go wrong.
I remember where I put them. They're under my desk. You want to see them? Okay, we can say yes. Remember how we practiced yesterday? We started in E position. Yes! Oh, that was very nice. Yes, I liked your E position. We slide, we use our sliding sound. Yes! Try it again.
So I think one of the important things to remember, that this really is a long journey, and that you need to take care of yourself.
Absolutely.
So you need to find that time, you know, once a week when you have someone come in to watch your children, and just go to the movies by yourself, or just curl up in a corner and read somewhere, or do something that makes you feel better or calmer or whatever.
Sure.
The other thing is, and we often talk about this, is, you know, to take care of your relationships. You are focusing a lot of time on your child with apraxia, as well as, you know, giving enough time to your other children. And I think you have to remember to make time for your relationship.
Yeah, and you know, I do talks on siblings and pay attention to make sure that either we don't underdo it with a sibling and not spend enough time with them, or we overdo it to compensate. Both things can happen, and siblings react in different ways based on their personality, but just important to make sure your whole life doesn't become one big therapy session to the detriment of other things.
Exactly,
So,
and that's not good for your child either,
No, it
because, you
isn't.
know, your child is still a child, and they still have a right to be 3 and do things that
Exactly.
3-years do, and things
I
like
tell
that.
parents all the time, just take a break away from speech for a week or 2. Go on vacation,
Right.
don't even think about it.
Right.
And sometimes the kids come back sounding better than when they left for vacation. It doesn't feel
We
good
don't
to us
believe-
as therapists when that happens, but we know it happens so
Yeah,
often, and we're
yeah.
happy. Yeah, we're happy that it does, but
We used to do that over Christmas. I would, for that week or so, we just all
it's
took a
healthy.
break.
It's a healthy thing.
Yeah, so,
I think, you know, just some of the things to keep in mind about what can go wrong, you know, as the mom mentioned in the video, you know, might not be an effective therapy for your child's age or what they're motivated by. Children are motivated by different, you know, symptoms. So, you know, one therapist said we have to be the coolest thing in their day for
It's
them
true.
to be willing
Yeah.
to take the risk to
Right.
talk. and come up with strategies that are meaningful for them, and play strategies often are what we're looking at, and a mix of some repetitive practice and play, and that takes some really skilled therapy time, and hopefully pass that skill on to parents as well. We need the children, to take those risks. Many of them get frustrated. I talked a little bit about healthy frustration. It really is a good thing for children to show frustration. It shows us they understand what they can't do, so some degree of understanding is shown through that, and also builds motivation for therapy. If a child shows frustration and then you as a therapist or a parent help them with their talking, and they realize, oh, I'm successful now, then they're hooked on you as a therapist, and they go, wow, this feels good, I want to go see,
Right.
Miss so-and-so, Mr. so-and-so, whatever, so, and then, other things, I know parents really want their kids to be polite, the little things like saying please. If we emphasize for the child to always use please, then they're not gonna build a wider repertoire of words. They get everything they want by just saying please. So those are just some things.
And no, maybe we should not teach them no.
Yeah. One word I teach the parent, because we want to give the children control, and I warn the parents ahead of time, you're not going to like me teaching your child this now. Now. But it's a power word, it's a control word, and our children sometimes don't have much power or control, right? They felt like speech is not something they can control with. So we do have a video of a child that kind of went with habitual production, and so we'll view that now.
Okay.
Yeah. Well, I think we've reached the point where we can kind of take a deep breath and summarize some of the major points that we're trying to make in this Apraxia 101 webinar. So we might, first of all, just thank you for joining us, and our summary points are, talking helps define who we are as humans.
Absolutely.
So if a child can't talk, people interpret that in different ways. They may think your child is intellectually challenged because they don't talk. And it also creates struggles for that child. They may become that non-risk taker, especially verbally. They can become more socially withdrawn because they haven't had much success in trying to interact with peers. They may lash out more physically, become more aggressive because they don't have the words to say, I'm mad, stop.
Right, it's just all part of that frustration that goes along with all that. We haven't talked about sign language much, but again, that's a tool
for sure
to help them with some of that frustration. Again, getting them into an evaluation early is really critical.
It's really important.
To getting them in therapy, so that they can have that control over their world that they need. The other thing is, I'm sorry, I wish I didn't have to say this, but there is no cure. There's no magic pill, there's no shot we can give them. What we can give them is therapy, and that's what's gonna help.
Yeah, someday maybe we'll get to that
Someday
point.
maybe, I
we
hope
would love
so.
nothing more than be put out of business, but
Well, a year or two.
a year.
Yeah, no, you're absolutely right.
Yeah.
And the other thing that is an organization that we support and really try to promote is the partnership. If we become partners with our children's therapists and the professionals in their lives, then that's only going to help our children. So creating those partnerships is essential. It's probably the most important thing that we do for our kids.
I think our organization is very unique. We hold a national conference that partners both therapists and parents together in the same rooms, looking,
learning from each other,
and nothing better. So, and I think lastly, we've come a long way since 2000, when things started really rolling with the Apraxia organization and this journey that we've been on as well. And but we know we still have a lot of work to do.
We do have work to do. We're not ready to shut the doors quite yet.
No, and We again appreciate the fact that you took some time to
Yeah.
join us for this webinar.
We
and-
do know how busy you are, so
Yeah, sure.
we appreciate you taking the time to be here with us today, and we
From-
look
yeah.
forward to seeing you again
Absolutely.
somewhere along the line.
From all of us at Apraxia Kids, we wish you the best of luck on your journey.